Okay, let's dive into something really critical for global health today, tobacco use.
Hmm.
It's not just, a personal habit. It's actually the single biggest cause of preventable death around the world.
It truly is. And when you look at specific places like India, the numbers are just staggering.
Yeah, the guide we're looking at today really drives that home. Globally, what are we talking about?
Well, globally, it's over 8 million deaths every single year. That's from both direct use and secondhand smoke.
8 million, wow. And how does India fit into that picture?
The guide highlights that nearly 1.35 million Indians die each year because of tobacco.
1.35 million.
Yeah, and think about this. That works out to over 3,500 people dying every day in India from tobacco.
3,500
Well,
every single day. That's just immense. It really frames the urgency, doesn't it?
absolutely.
So for this deep dive, we're digging into a very specific, very practical source. It's a guide for health workers in India.
Right, the frontline workers,
Hmm.
people like ASHAs, MPWs, ANMs,
Mm-hmm.
the ones actually out in the communities.
Mm-hmm. Exactly. And this is a government guide designed to equip them, right? To help people quit.
Precisely. So our mission here is to unpack this guide, pull out the key facts, the strategies, what actually works on the ground.
We want to understand the scale, the health impacts, all the different forms tobacco takes in India.
The actual step-by-step approach they're taught, the AAR model.
Right. And the benefits of quitting, plus the legal side of things. Basically, this is your shortcut to understanding a huge public health effort in action.
A shortcut to the reality on the ground. Yeah.
Okay, let's start with that scale then. The guide lays out the impact pretty starkly. Beyond the death tolls, what else does it stress?
Well, a huge one is the cancer link. The guide states that 33 out of every 100 cancer cases in India are linked to tobacco.
A third of all cancer.
A third. And it gets even sharper with oral cancer. Nearly 95% of all oral cancers are found in tobacco users.
95%. That's almost unbelievable. It points heavily towards, I guess, smokeless tobacco use.
Very much so, although smoking contributes too. But the link is incredibly strong. And it's not just cancer.
No, the list of other diseases is long, isn't it?
It really is. The guide mentions stroke, heart attacks, lung diseases like COPD, blindness, even impotence. There's a specific condition, Berger's disease.
Affecting blood vessels.
Exactly. And specific risks for women are called out too. Fertility issues, problems during pregnancy like spontaneous abortion, low birth weight, stillbirths, and also cervical cancer.
It really attacks the body from all angles. And there was a point about lifespan, too.
Yes, a very blunt one. Tobacco users, on average, die 10 years younger than non-users.
10 years. A decade of life.
A full decade. That really hits home, I think.
It does. Now, the guide makes it clear that tackling this means understanding how people use tobacco. It's quite varied in India.
Oh, absolutely. It's not just cigarettes. The guide talks about smoked forms like biddies, cigarettes, of course, hookahs, chillums.
And it mentions the chemicals in smoke.
It does. It gets quite specific. Cigarette smoke contains over 7,000 chemical compounds.
7,000.
And get this, among those are 200 known poisons and 69 chemicals known to cause cancer. Carcinogens.
Just staggering numbers. And that's just the smoke. What about smokeless tobacco? That's huge in India.
Huge. The guide lists things like kani, gutka, zarda, pan masala with tobacco, mawa, misri, gul. Lots of local forms.
Right.
And it stresses these are not safe alternatives. Smokeless products, it says, have over 3,000 chemicals, including 28 known carcinogens.
So smoked or smokeless, the message is clear. It's dangerous.
Extremely dangerous.
The guide also touches on newer products, right? The electronic ones.
Yes, he calls them emerging products, things like EDS, that's e-cigarettes, basically, and HTPs, heated tobacco products, and also e-hookahs.
Okay, and what's the key takeaway for health workers about those?
This is really important legally.
Mhm.
The guide states very clearly that these emerging products are banned in India.
Banned, okay.
Yes. Under an act called PICA 2019, Prohibition of Electronic Cigarettes Act. The guide emphasizes they contain harmful stuff too. Nicotine, heavy metals like lead, volatile organic compounds, carcinogens. They are not considered safe and are illegal to sell, import, advertise, the whole lot.
That legal clarity is vital for those workers.
Mm.
Okay, so we have this picture. Massive scale, diverse products, severe health effects. How does the guide tell health workers to actually do something? What's the practical plan?
That brings us to the core strategy, the AAR model.
AAR. Okay, let's break that down. What's the first A?
The first A is for ask.
Mhm.
Simple but crucial. Health workers are told to ask everyone in the community if they use tobacco, smoking, or chewing.
Everyone, not just people who seem unwell.
Everyone, especially during things like community health surveys, the CBC surveys,
Hmm.
you need to identify who's using first.
Right. You can't help if you don't know who needs it. Makes sense. What's the second A?
The second A is advice.
Mm.
Once you identify a user, you advise them to quit.
How strong?
The guide says it should be clear, strong, and personalized advice. It even gives examples of what to say.
Oh, like scripts.
Sort of, yeah. Like, as your health worker, someone who cares about you, I strongly advise you to quit. Or more direct, I want you to quit as soon as you can. The key is delivering that message with care, but also with conviction.
Having those phrases must be really helpful. Okay, ask, advise. What's the R?
R is for refer. If the person seems ready or willing to try quitting, the health worker's role is to connect them to more support.
Like specialist help.
Exactly. Refer them to the nearest tobacco cessation center, usually at a district hospital, or help them register with the National Tobacco Quitline Services, the NTQLS.
Is there a number given?
Yes. The guide provides the National Quitline number, 1-800-11-2356.
Okay, so ask, advise, refer. A clear pathway. But what about people who say, no, I'm not ready?
Yeah, the guide addresses that directly. If someone isn't ready to quit, the advice shifts
To what?
to education. Reinforce the health risks, but also talk about the economic cost.
Ah, the money aspect.
Exactly. Help them think about what else that money could buy. Food for the family,
Mm-hmm.
clothes, education for the kids. Make it really tangible.
That's a smart angle. Hit them in the wallet, so to speak. Now, for those who are thinking about quitting, the guide talks about the benefits, right? That must be motivating.
Hugely motivating.
Hmm.
It lays out a timeline showing how quickly the body starts recovering. It's quite amazing, actually.
How quick is quick?
Within 20 minutes, your blood pressure starts to normalize.
20 minutes. Really?
That's what the guide says.
Yeah.
Then, within 24 hours, all the nicotine is out of your system.
Okay.
After 48 hours, your sense of smell and taste start coming back to normal.
Those little things you might not even realize you've lost.
Exactly. Then longer term, after about 2 months, your lungs start working better, more efficiently.
And the big risks. Heart attack, cancer.
Big reductions. After just 1 year of quitting, your risk of a heart attack drops by half compared to a smoker.
Half in 1 year. That's significant.
It is. And after 10 years, the risk of lung cancer is halved compared to someone who keeps smoking.
Wow. So the message is clear. Quitting works, and it starts working fast.
Absolutely. It's never too late.
So how does the guide tell health workers to actually help someone quit? Beyond the AAR model, what are the practical tips?
It gives some very concrete steps for the health worker to share. First, help the person build their determination. Really commit.
Okay.
Then, assist them in setting a specific quit date. And really stress sticking to it.
Setting a target.
Yes. And then practical stuff. Get rid of everything related to tobacco. Cigarettes, BDs, gutkah, lighters, matches, ashtrays. Remove the triggers.
Out of sight, out of mind, maybe?
Kind of. Also, tell your family you're quitting. Get that social support.
Good point.
And crucially, help them identify their personal triggers. What situations make them want to use tobacco? Seeing a shop? Being with certain people? Stress?
Amen.
Help them figure out how to avoid those situations, especially in the first few difficult weeks. Plan ahead.
That sounds really practical, dealing with the habit, not just the substance.
Exactly. Which ties into the myths the guide tackles. Because people have reasons or excuses for not quitting.
Right. What are some common myths it debunks?
Well, one big one is that just talking behavioral counseling doesn't work. People think, I can quit myself if I want to. How can talking help?
And the fact.
The fact, as the guide explains, is that tobacco use becomes a deeply ingrained habit. It gets linked to emotions, stress, boredom, anxiety, and daily routines. Those are triggers. Behavioral counseling focuses specifically on identifying and managing those triggers, changing the habits. That's often the key.
So it's about rewiring the brain's routines. Okay, what else?
Another common myth. The damage is already done. Why bother quitting now?
We already know that's not true from the benefits timeline.
Exactly. The guide's fact is simple. The body starts comparing itself immediately upon quitting. Benefits start right away.
Powerful message. What about mental health concerns? People worry quitting might make things worse.
Yes, that's a myth. Quitting will worsen my anxiety or depression. The guide acknowledges withdrawal can be tough.
How so?
You might feel irritable, restless, have trouble sleeping or concentrating, feel anxious, depressed, hungry. But the guide stresses these are usually symptoms of nicotine withdrawal, not the underlying mental health condition getting worse.
That's a crucial distinction.
Very. And it says these feelings usually pass within a few days or weeks.
Good to know. Any other major myths?
One more key one. Secondhand smoke might be annoying, but it's not really dangerous.
The passive smoking argument?
Right. And the guide is blunt. Secondhand smoke kills hundreds of thousands globally each year. Breathing any amount of tobacco smoke isn't healthy. Period.
That really broadens the impact, doesn't it? It's not just about the user.
No, it affects families, coworkers, everyone around them.
Okay, so the guide covers health, behavior, myths. But it also mentions the law, right? There's legal backing for these efforts.
Yes, definitely. The guide makes sure health workers know about the legal framework. The main law is COTPA 2003. Yeah, it stands for the Cigarettes and Other Tobacco Products Act. It covers things like prohibition of advertisement and regulation of trade and commerce, production, supply, and distribution.
Sounds comprehensive. What are some key things under COTPA that the guide mentions?
Well, Section 4 prohibits smoking in public places. There are fines for individuals and for the owner or manager of the place.
Okay.
Section 5 bans advertising tobacco products, and the penalties for that are quite steep, especially for repeat offenses. Shows they're serious about stopping promotion.
What about sales, especially to kids?
Crucial point. Section 6 specifically prohibits selling tobacco to anyone under 18, and also selling tobacco within 100 yards of schools or colleges.
100 yards, that's specific.
Yes. And then Sections 7, 8, and 9 deal with health warnings on packaging. They mandate specific warnings, pictorial warnings, and there are serious penalties for manufacturers or sellers who don't comply.
So, laws covering ads, public smoking, sales to minors, and packaging warnings. That's quite a net. And didn't we mention PICA 2019 before?
Yes, the guide reiterates that one for electronic cigarettes. PICA 2019 bans pretty much everything related to e-cigarettes. Making them, importing, selling, transporting, storing, advertising, all of it.
And the penalties.
Significant. Imprisonment and hefty fines, increasing for a second offense. It's a clear message. These are not welcome.
Right. Any other laws mentioned?
One more, the Juvenile Justice Act, or JJ Act, from 2015.
How does that relate?
It makes it illegal to give any intoxicating substance, including tobacco, to a child under 18.
So it's not just about selling, but also just giving tobacco to a minor.
Exactly. And the penalty is severe, up to 7 years in jail and a fine of 1 lakh rupees.
Wow. That adds another strong layer of protection for children.
It really does. It shows the multi-level approach.
Okay, this has been incredibly insightful. This deep dive into the health worker guide, it really paints a picture, doesn't it? We've seen the, frankly, terrifying scale of the problem in India, the sheer variety of harmful products.
And then this clear, structured plan, the AR model,
Yeah.
that gives workers something concrete to do.
Right. And the motivation, those immediate and long-term benefits of quitting. Plus, tackling the myths people use to avoid quitting.
And underpinning it all, this quite robust legal framework.
Yeah.
COTPA, PICA, the JJ Act.
It gives you a real appreciation for what's involved in tackling a public health crisis like this. It's not just one thing. It's about empowering people on the ground, giving them the facts, the strategies, the legal backing.
To make a difference, really, one person, one conversation at a time.
Okay.
It's complex, but also very focused.
It really is. It shows progress needs action from so many different angles. You know, thinking about all these different parts, the counseling, the laws, understanding the products, the health messaging, it makes you wonder, for a challenge this huge, this widespread, what you think is the single most important lever to pull? Where can we make the biggest difference in this fight against tobacco?